Thanks very much for the introduction there, Dr. Kelleher, and thank you all for the opportunity to speak here today on recent trends in pertussis notifications in Ireland. I'll just start off by saying a few words on a background of pertussis or whooping cough. So it's a vaccine-preventable disease and has been notifiable in this country since 1948. It's a highly infectious bacterial disease and involves the respiratory tract, and it is caused by the Bordetella pertussis. Sorry, let's go back there. Initially, symptoms may resemble a common cold, and within a couple of weeks, a severe cough may develop, characterized by episodes of rapid coughing followed by a high-pitched whoop. It is transmitted through droplets or direct contact with discharges from the nose and throat of infected individuals. So what are its public health implications? Well, first of all, there's a potential for interruption of spread through outbreak control measures such as antibiotics for close contacts of cases and through vaccination as a preventive measure. It may occur at any age, but most cases in Ireland occur in children less than 5 years old. And it's particularly the young infants, those less than 6 months old, who are particularly vulnerable to pertussis and its very serious complications. And these may include pneumonia, middle ear infection, seizures, encephalopathy, apneic episodes, and even death. So therefore it's extremely important, and I'm sorry, I don't know what's happening there. It is extremely important that the pregnant women receive the vaccine in each pregnancy so that they pass on maternal antibodies to protect young infants in the first 6 months of life or so. And it's recommended that this is given between 16 and 36 weeks in each pregnancy. So for the purpose of this brief presentation, I reviewed the historic pertussis notification data from as far back as 1948 until 1997. That data was provided by the Department of Health, and then the notification data since then, from 1998 till this week, week 21 of 2019, was extracted from the computerized infectious disease reporting system that Sarah mentioned in the previous presentation. Basic descriptive analysis was conducted using Microsoft Excel. I should highlight that the 2018, again, sorry about that, and 19 data are provisional. Any international data was sourced from relevant internet sites. So, moving on reviewing data on annual pertussis notifications in Ireland between 1948 and 2018, we can see that prior to the introduction of the first pertussis vaccines in Ireland in the 1950s, pertussis cases and deaths were common, with annual case numbers reaching as high as 5,000. And following the introduction of the wholesale pertussis vaccine in 1952 and 53, there was an overall downward trend until a loss of confidence in the vaccine occurred in the mid-70s due to unfounded safety concerns, leading to a decline in uptake. As a result, case notifications rose substantially in the latter half of the 1970s and early 1980s. As public confidence was restored, vaccine uptake improved again in the latter half of the 1980s, and as a result, notifications reduced to low levels in the late 1990s and 2000s. A peak occurred again in, I'm not sure what's going on here. A peak occurred again in 2012 due to waning immunity primarily associated with the earlier introduction of the acellular pertussis vaccine, which is a less reactogenic vaccine but also less immunogenic vaccine compared to its wholesale vaccine equivalent. And around this time, an adolescent booster was introduced, and the antenatal pertussis vaccine was recommended by the National Immunisation Advisory Committee of the Royal College of Physicians of Ireland. And most recently, although it's not on this slide, a national outbreak of pertussis was declared in November of last year. So then moving on to compare to another country in terms of their trends, more recent trends. This slide displays trends in confirmed pertussis incidence per 100,000 population by age group in England over the last 20 years. And on reviewing these data, we can see that there was a notable peak in 2012, particularly amongst children aged 10 to 14 years, represented by the green line. And also and young infants less than 3 months old, the particularly vulnerable group, represented by the dotted blue line. It is likely that waning immunity following the switch from the wholesale pertussis vaccine to acellular vaccine contributed to this increase in cases. And in response to this situation, a national outbreak of pertussis was declared by the Health Protection Agency in April of that year, and a fully funded and resourced temporary immunisation programme for pregnant women was introduced from October of that year. In that peak epidemic year of 2012, unfortunately 14 deaths were reported in infants with confirmed pertussis. However, since then, the antenatal vaccination programme has been extended, and there has been a reduction in pertussis incidence in infants less than 3 months of age. Similar trends have been reported by the WHO in other countries, indeed other regions of the UK, including Wales and also in the US. So, I'm just going to check that we're on. Yeah. When looking at pertussis notifications in Ireland by age group over the last 10 years, we can see that infants aged 0 to 5 months, displayed as the blue line in the upper aspect of the figure here, represented the highest proportion of notified cases each year amongst all age groups. And in this time period, unfortunately, 5 infants aged 0 to 5 months in Ireland died from pertussis. We also note the resurgence in notifications across all age groups in 2012, and as mentioned before, this represented the first indication of waning immunity, and particularly amongst older children and adults. And if we focus in on, on the provisional 2019 data, there is a suggestion of a greater reduction in the 0 to 5 month age group compared to the other age groups, which may indicate the impact of recent vaccination efforts for pregnant women following the declaration of a national outbreak in November of last year, and the vaccine changes that came with that I will mention briefly in a moment. So it is also useful to look at pertussis vaccination status of mothers of infants who have been notified with pertussis within the context of a number of antenatal vaccination policy changes that have occurred in Ireland in recent years. In December 2012, as mentioned previously, NIAC recommended that the Tdap or booster vaccine be given antenatally. Then in September of the following year, the HPSC provided the vaccine itself free of charge, but not its administration fee at that point. Between 2012, when NIAC first recommended pertussis vaccine in pregnancy, and week 21 of this year, vaccination status was reported in approximately half of notified infants aged 0 to 5 months. And of these, almost 9 in 10 mothers reported that they were not vaccinated during the antenatal period. In November of last year, as I mentioned before, a national pertussis outbreak was declared in Ireland, and the vaccine administration fee also became free of charge. And since the outbreak was declared in November of last year, almost 7,000 pertussis vaccines have been paid for by the HPSC through the outbreak code. This figure, I should highlight, does not represent all pertussis vaccine given antenatally. For example, it would not include vaccine given in maternity hospitals. It is also not possible to say that all of these vaccines were given to pregnant women, as there are other indications for the use of the outbreak code, including control of local and family outbreaks of pertussis. However, I think it serves as a broad indication that a substantial number of antenatal vaccines have been funded and given in the primary care setting since the outbreak was declared. So, in Ireland, I've tried to demonstrate that the incidence of pertussis has substantially reduced since the first introduction of pertussis vaccine in the early 50s. An upsurge occurred in 2012, which may indicate waning immunity, particularly in older children and adults, and similar findings were seen in a number of other countries around the world. Most pertussis notifications occur in infants, and particularly those young infants who are the vulnerable age group to the very serious complications from pertussis. I've highlighted some of the positive changes that have occurred in vaccine policy in this country in recent years to address this issue. The vaccine is now freely available to pregnant women, yet uptake remains inadequate to effectively prevent morbidity and mortality in young infants. I've looked at the provisional 2000 data, which suggests a positive impact in pertussis in the younger infant age group. And in conclusion, the burden from pertussis has reduced substantially in this country over the last number of decades. However, despite the availability of a safe and effective vaccine, pertussis continues to pose serious risk to infants, particularly those younger infants aged less than 6 months. There is therefore a need to continue to encourage and facilitate pregnant women to get the vaccine, and consideration needs to be given to providing pertussis vaccine to pregnant women on an ongoing basis through a funded national programme so that uptake can be sustained into the future. And thank you very much for your time. I'd like to acknowledge the following groups. I should also mention there that practice nurses and all the community healthcare workers should be highlighted there as well. Thank you very much. Thanks.